What's quite interesting is that patients will often come in and say they're worried about a certain part of their face. So they'll say, oh, I've got a large nose, or I've lost some volume in my cheeks, or I want some lip filler, or they'll say something. And actually, what as cosmetic doctors we do is assess a patient in total. And a very, very common thing we actually end up correcting or just fine-tuning a little bit is actually the chin. And the chin is not commonly an area that people come in and talk about unless they've got a receding chin or something that's very obvious. Most people won't really notice their chin. But actually, it's a really important part of beautification. It's a very important part for males and females as well, because a strong, defined, chiseled jawline and chin is actually a very masculine thing and a very attractive feature. But for females, it's actually all about balance. So when we look across a room or we look at a face, we are inherently tuned to what is beautiful. And it may be a whole mix of different features. There's lots of things we perceive to be beautiful. But the secret is the balance of the face. And it's the balance between the forehead, which we call the upper third of the face, the mid-face, which is generally regarded as the cheek area, and then the lower face, which is normally the gap between the lower part of the nose and the tip of the chin. So if the balance and harmony is good between those three things, we perceive the face to be very beautiful and very appealing. So sometimes, if the chin is a little weak or a little bit recessed, just by literally putting a very, very small amount of filler in the chin, just to redefine and rebalance the harmony of the face, it really is spectacularly impressive. It's very subtle, but it beautifies, it gives balance, not only looking at the face from the front, but also from every angle. So when we look from the side, the 3/4, and at the front, it just looks very, very attractive and very appealing. And for experienced doctors, it's very easy to just give that balance back.